Being able to connect with somebody who has a child similar to mine was amazing.
My name is Kelly, and I'm part of the G2 Mentor Program here at GCH.
My name is Shelby. I am a mentee of Kelly. We've been part of the program for about 2 years.
So my son Eli is 9, and he's had his G-tube now for over 7 years. When Eli received his NG and G-tubes, the hospital staff were great with showing us how to do everything. Before we got home, we were here for several days for both procedures. But what was hard is that we live in more of a rural area, and so we knew nobody with a G-tube or an NG tube. So reaching out to anybody was tough. They told me about the G2 Buddy program, and I just want to be able to help because it would be helpful if I would have had that when I was initially starting.
My daughter's name is Elsie. She had a really long NICU course here at GCH. She was intubated, meaning that she needed a breathing tube for about 8 weeks of that. And so she developed something called oral aversion. She just doesn't want anything in her mouth, and she didn't gain the skills to be able to feed. We were given a couple different options as far as like feeding tube, and the G-tube was definitely the right move for her long term. I had first heard about the buddy program through social work. Knowing that this was an opportunity to connect with a mentor and have somebody who has more knowledge about this than me was really important.
When I initially call one of the families, I tell them all about our journey of the G-tube and everything we've kind of been through. Ask if they have any questions or concerns, how they're feeling with the transition to their tubes, just there for support and with anything they need. Like be texting whenever.
Being able to connect with somebody who has a child similar to mine was amazing. I mean, I can't tell you how many times I've reached out to Kelly being like, is this normal? What does this look like? What should I do? Should I call the doctor? And you know, it really does take a village to do this, and having Kelly by our side has been imperative.